Hi, Dr. Mark Jabor with Cosmetic Surgery and Laser Center of El Paso. Today we are going to be performing a buttock lift and a medial thigh lift, or a medial thighplasty. So this patient presents, she had an abdominoplasty done elsewhere over 6 months ago, and she was still unhappy with the sides and the laxity of the buttocks and on the outer thighs, as well as the laxity of the skin on the inner thighs. So we talked about some different options, and I felt that this would be the best option for her. I've already performed some liposuction in the back area and in the inner and posterior thighs. I didn't show that portion because I thought the more interesting portion would be the excisional portion. So that's what we're going to start. So the buttock lift is very similar to the circumferential abdominoplasty. However, once we get to the front portion or the anterior portion, the incision will just taper down, and we won't have to lift all the skin because that was already done. So I will get started, and I'll show you some of the key steps as we go along. So elevated all this area like we talked about, and you can see when I get my hand on there. So I'm kind of past this blue line in the elevation. So now we're going to check and see how much skin I can safely remove. So we'll use this little device here. We'll both pull back, myself and my assistant, and we'll mark. So I'm just a little past the line, and we'll keep going there. But you can see how much when we do that, what the lift that you get on the buttocks. So that's the lift part. So we're going to keep marking there. We'll take off this ellipse of skin, and then we'll start closing. Okay, so we have excised that chunk of tissue, so you can see it's removed. Pretty good amount of skin and fatty tissue that we've taken out. And so there, here's the defect. So when you close, this tissue here is pretty adherent on the lower back, so the tissue is going to move from inferior to superior. So from buttocks and outer thigh, it's going to close to meet this incision, which will give us the lift. So I'm going to remove the tissue on the other side, and we'll start with closure. So we're starting the closure. You can see a drain has already been in place. It's a 3-layer closure. So this is the deep stitch here. This is really the one that provides a lot of the strength. So this would be layer number 1. I'll put several more of these, and I'll show you layer number 2. So this is the second layer. And it's going to go not right under the skin, but much closer than the other. And it's a barb suture. And I'll use a barb suture on the final skin closure too. So this is what we call running suture, because I'm not tying each one of them, but it's going to go back and forth. So it tends to make it quicker. So I'll continue on with that, and I'll show you the actual final closure. So we're all done. The incisions have been completely closed. Glue is on. Again, we do have this dog ear here that we will contend with once the patient is back in the face-up position, and then that will be the completion of the buttock lift. So we are going to place her in the face-up position and finish off. So I removed that dog ear. Here's the drain that I brought it out here from actually one of her original drain incisions. And so you can see now that sits down nice and flat, and it joins up with her previous abdominoplasty incision. So we'll put glue on this, go to the other side, and start with the medial thigh lift. All right, so we've repositioned, and we're ready to do the medial thigh lift. So the red is the natural groin crease. So that's where I'm going to make the incision, elevate skin, and everything is going to be pulled up to this groin crease, because we're going to anchor it on deep tissue that's very sturdy here at the groin crease. We don't want this to migrate down inferiorly. So this is the proposed amount of skin to be removed. So you can see what that's going to do to the medial thigh. That's going to bring all this skin in. So when I say the medial, I mean the inner portion of the thigh. So that's what's going to help. So she's marked out, ready to go. We're going to get started. So I began the incision here. I'm going to continue on. Again, I've injected this with local anesthesia so that the bleeding is minimal. That was a previous liposuction site there. So incision's complete. Now we just need to go and elevate, and we're going to elevate from medial to lateral. So we'll start that process, and then I'll show you once we get a little further underway. So incision was made, tissue was elevated. So I've gone a little bit past the blue line. I've already checked, maybe hold that there. I've already checked the markings with that instrument, and so this is the amount of tissue that we're going to remove. So it's ready to be excised. So we'll just have to start removing it now. So I'll come back and show you once this is removed and we start to close. All right, so we are all done here on this on the right side, and you can see here, and you compare the two sides, you can see the amount of laxity that still remains here as compared to there. So I'm going to go and we'll probably remove about this amount of skin and tissue, just like we did on the other side, and I'll show you when we're done, and we'll wrap this case up. Okay, so we're all done here. You can see both sides have been excised, both sides have been closed, had done liposuction before this, so we're going to get her out of this lithotomy position and get dressings on. And you can compare this to the before picture that we have here, and you can see the laxity of the skin on the medial thighs and what we'll have, plus the redundant tissue and loose tissue that in the posterior trunk. So both of those things were done. Also, I did liposuction. I didn't show that. Anyway, I hope this was helpful and educational. Dr. Mark Jabor, Cosmetic Surgery and Laser Center of El Paso. Thank you for watching.